welcome everyone to our first LEAP series of 2025. So again, welcome and greetings. I just want to say a little bit about ABCD and these LEAP series before we get started with Dr. McAndrew and caring for each other, which is so important, especially in this space. But if you don't know ABCD, or if this is your first time joining us, ABCD is a peer-to-peer mentorship virtual organization. We've been around for 25 years and we match people, mentors, with participants or people looking for support. It is one-on-one virtual support. We can do it anywhere. And it's over the phone, it's text messages, Zoom or Teams calls. And it's really specific to not only your diagnosis and treatment plan, but where you are and your stage in life. So your age, if you've got kids or if you're retiring, just a myriad of different unique experiences that we all have. And so those are important to every single one of us as we've gone through breast cancer or a loved one that you know that's gone through breast cancer. So it's really important for us to be here in this space and offering support however we can. Now I'd like to introduce you to Keisha Jones, who is our Director of Healthcare and Community Partnerships. She's gonna talk and introduce Dr. McAndrew, who's gonna host our session this evening.
Thank you so much for that wonderful introduction, Carrie, and just thank all of you for joining us this evening. I did put in the chat, just feel free to let us know where you are logging in from. We always just like to connect with you and know where you are joining us from. So I have the pleasure of introducing our speaker, just a wonderful person who I connected with last year, and just the work that she does in terms of caring for others and just in this caregiver space. We just thought we had to bring her before our ABCD community. So I'm going to share a little bit about Dr. McAndrew. She is an associate professor in the School of Nursing in the College of Health Professions and Sciences at the University of Wisconsin-Milwaukee. She also holds an appointment as a nurse scientist for Froedtert and the Medical College of Wisconsin Froedtert Hospital. She was recently appointed the Joint Professor of Nursing Research for Froedtert Hospital and UWM School of Nursing. Dr. McAndrew's research focuses in developing and testing palliative-based interventions for patients experiencing serious illness and their family caregivers, with a goal of translating these interventions into routine clinical practice. Dr. McAndrew's work has been published in the Clinical Journal of Oncology, Nursing, Journal of Family Nursing, and Psycho-Oncology. She is the recipient of a Cambia Health Foundation Sojourn's Scholar Leadership Award and an Oncology Nursing Foundation research grant. And again, we're just so excited to have her, especially as we start our caregiver family and friends training, just to have her knowledge and expertise. So welcome, Dr. McAndrew, and I will turn it over to you.
Well, thank you so much, Keisha. I really appreciate that. It is, my honor and pleasure to be here tonight. I'm going to go ahead and share the slideshow. I'm hopeful that you see it. Is that good? Okay, great. All right, so tonight we're going to talk about ways to cope as a team to navigate a breast cancer diagnosis, treatment, and survivorship. I think everyone can feel really lost at times during this experience, kind of like you're out at sea trying to stay afloat. But there are life preservers out there, and you can receive one, and you can also throw a life preserver as you navigate the role of patient and caregiver. You each need individualized support, time to talk to someone who's going through a similar experience, and I am so grateful for ABCD, so you have that kind of resource. But there's some support that you need to provide to each other. The person who's supporting you, whether that's your partner, your sister, your brother, your friend, whoever that is who's closely involved in your care, you have this shared experience of going through this together. And there's conversations that you can have to really strengthen your partnership through this very serious illness experience. My goal today is to provide some insight about the caregiving experience and the shared experience. I'm hoping to give you maybe some conversation starters, ways to talk about what you need individually and as a team, so you can better support each other and feel that sense of connection, particularly when things are difficult. I do want to share a little bit more about my background so you have some context about who I am. I am a longtime practicing nurse, 20 plus years. I worked also as an advanced practice nurse and as a researcher. My passion and my purpose is really supporting families who are coping with serious illness. And I like to do that in partnership with the experts, which is all of you. Nobody is a better expert than the person who is living through that experience. So I'm hopeful tonight that you'll feel free to share things, ask things. If you ask a question that I don't know the answer to, I have a community of people that I can turn to so we can find the answer for you. So tonight is really to be an open learning forum, and I, welcome you to stop me, ask questions at any point as we go through this. All right. So before we get started, I'd love to hear from all of you. And I know there are a lot of people on, and I might have to ask Keisha and Carrie to give me a hand because I can't with the slideshow, I can't really see people very well. So I just want to get a sense of who is participating tonight. I'd like to ask how many of you can maybe raise a hand or use the function in Zoom to raise a hand. How many of you are a person living with a breast cancer diagnosis, or you're a survivor, a thriver? Can we get a sense? And I'm going to ask Keisha and Carrie to help count that for me, just so we can kind of get some numbers or just a general sense. Okay. I'm seeing some hands go up. I'll give people a minute more here. And then I'll ask my next question. I'd love to know how many of you that are on the call tonight are supporting a person who is living with breast cancer or is a survivor, thriver. Oh, I'm hearing them. I'm hearing the hands pop. That's great. Keisha and Carrie, what kind of a mix do we have? Do you have kind of general numbers?
I'm seeing a lot that are saying they are survivors. Looking to see if I see some that say, well, I see some both survivor and supporter, like caring for someone, but the majority looks like survivors. Carrie,
Okay.
you can chime in too if that's what.
Yeah, it looks like there's a few supporting, but
Good.
yeah, it looks like the majority are, survivor thrivers. And then, yeah, there are a few supporting on here too, or both. So that's great.
Well, and of course, absolutely, there are people doing both roles. So that's just thank you. Thank you for that. It is helpful to know who's here tonight. So thank you for that. So I want to start tonight by sharing two different perspectives. So I'm going to first give you a soundbite from a thriver. When I was diagnosed with breast cancer, I felt an overwhelming sense of isolation. Despite having supportive friends and family, the physical and emotional toll of treatment left me feeling alone. The side effects kept me homebound, and I avoided social gatherings. The fear of the unknown and constant worry about treatment effectiveness weighed heavily on me, making it hard to connect with others. Even with support, I often felt like I was navigating this journey alone. Now, we are going to hear about this same situation, but now we're going to take the vantage point of the caregiver or the support person. I felt an overwhelming sense of responsibility. Despite having supportive friends and family, I felt helpless watching her struggle. It was heartbreaking to see her withdraw from the world. The fear of the unknown and the constant worry about the effectiveness of treatment weighed heavily on both of us, making it hard for her to connect with others and for me to know how to best support her. I tried to be there for her in every way possible, but there were moments when I felt inadequate and overwhelmed. The emotional strain was immense, and I struggled with my own feelings of helplessness and frustration. Watching her battle through the physical and emotional challenges was incredibly tough. I wanted to take away her pain and fear, but all I could do was be there, offering my presence. So, the reason why I shared these vignettes was to bring forward this idea that you are living through a shared experience, but you, of course, have different perspectives, right? We all have our own vantage point in the situation. And while we can feel very alone at times in that situation, the gift of a shared experience is that you actually aren't alone. The people that love you, that are supporting you, they're experiencing something too. And your caregivers want to be the very best support person that they can be. So it's through this shared experience that you have the opportunity to actually support each other. But to optimize that, you need strategies to talk about this experience and how you're doing. And you also have to find ways to get what you need. And what you need may change over time. And you also have needs as a family. You provide love and support to each other. So support needs to be both at the individual and the family level. And I want to acknowledge that family is whoever you say it is. I think of family as anyone who's supporting you. I'm also going to use the words tonight, patient and caregiver, simply just for role clarity. So now I want to talk a little bit about some of the emotions that maybe you have both felt as patient and caregiver at some point. You might have thought, I don't really want to do this. I did not sign up for this. At times, you might have felt kind of mad at the situation, mad at a sense of powerlessness. But sometimes it also feels really good to get mad at those around us. And we take things out sometimes on those we love because they're there and they're our safe people. They're going to forgive us. And it's a normal and human response. Maybe, you both said, this stinks. The situation really stinks. And for those of you who may be in a supportive role, you might have thought to yourself, I don't really feel like I'm a good caregiver. I'm not good at this. Maybe for you in a patient role, you might have thought, I don't feel like I'm a good patient. Of course, there's not a guidebook for this experience. You're figuring it out as you go, and that can be hard. But perhaps you've come here tonight because you thought, I would like some help and some strategies to navigate this. Being aware of all perspectives and working on communication with those you love is an opportunity for sustained growth in your relationships. And it's all about being fully present for each other. So I'm so glad that you came here tonight. Thank you for coming. So there are many emotional burdens as part of a cancer experience: anger, fear, hopelessness, depression, loneliness, low self-esteem, and existential distress as you may worry about the future and what's happening next. That can all really amplify other negative emotions. And of course, this affects quality of life. But the important part of all of this is that you're not alone. And it's also important to take away tonight that it's okay to feel some of the negative emotions. Sometimes fighting our emotions makes it really difficult. Sitting with our emotions can be important. Sharing your feelings, your emotions with someone that you love and trust can be very helpful as well. And sometimes you might find it to be a very validating experience because you might actually be feeling the same way. I don't know if anybody is familiar with acceptance and commitment therapy, also known as ACT, but it is a really beautiful way to reframe your response and get what you need in a situation. So I'm going to take us through it a little bit. so you can just get a sense of kind of how this technique works. So what you need to do if you're practicing ACT is you acknowledge and you accept your full range of thoughts and emotions. And this is important, you stop trying to avoid or alter them. So I think it was really meant to be that we would have a conversation about ACT today because I am taking a seminar this week and we were talking about ACT, and she put up a cactus as her slideshow. And the thing about a cactus is that if you hold on to it really tightly, it's going to hurt. It's very, very prickly. And I think sometimes we feel this immense pressure to avoid our negative emotions. We feel this pressure to be happy, to be grateful. And it's okay to sometimes feel like we're not. And we often can have these opposing emotions too. And I'm just thinking of an example of, let's say you had a pet that was with you for 18 years. Certainly, you love that pet. You're grateful for the time you had with that pet. But there's also a lot of grief and despair when that pet dies. So I think it's important that we let ourselves feel and not judge ourselves. And that actually can help us do more of the things that actually do make us happy. So what you do when you're practicing ACT is you change how you react to those distressing thoughts. You simply observe them, which is just like easier to say than do, right? But you let the emotions just sit there with you without judgment. That's such a critical part of this. Do not judge yourself for your emotions. You become very mindful in the moment. And the other thing about ACT that's so helpful is it makes us think about our values, what's important to us. Let our values be the guide for our behavior rather than our emotions. This leads to taking steps and changing behaviors ultimately that more align with our values. And as we do that, that of course eases distress. So I am not an expert by any means in ACT, but I love it. It's something that I want to use as part of an intervention with patients and caregivers in my future work, because I think that sitting with emotions liberates us in many ways. It allows us to fully align with who we want to be, and it also helps us practice self-compassion. And I'm really happy to provide any follow-up resources if others are interested in ACT. One thing that I would, I don't want to say challenge you to do, but invite you to do, I should say, is to do some value identification in your life. What matters to you? What drives you? Stay connected to those things. It can be really, really helpful. Now, the other thing I want to talk about tonight is open empathic communication. So we know that those who communicate openly tend to have less distress during serious illness. So, particularly when thinking about couples, dyadic coping, or how we cope together, is just as important as individual coping strategies. So, joint or dyadic coping includes things like seeking out information together, problem solving together, positive reframing together, relaxing together, showing each other love. Open and empathic communication seems pretty obvious, but I think it's a little harder to practice. It's again a mindful thing that we have to do. So I'm going to take us through some skills, some ideas to get conversations started using a more open and empathic approach. Active listening, right? Nodding, showing you're engaged, fully being present. Asking open-ended questions. Can you tell me more about that? This one is a magic maker, validation. And I am going to tell you about my own experience with validation. I have a therapist friend who actually helped me write a text to my partner that I had been fighting with. And he said, validate him. Tell him that you appreciate the hard load he's been carrying in your absence. And I did that, and I couldn't believe how well it worked. The way that he responded back was actually quite beautiful, and I felt a sense of connection to my partner. So validation is a really important part of communication. And you might say things like, it makes sense why you're thinking that way about what we discussed with the doctor. I mean, it feels good for someone to get you, right? And that's a big part of validation. We also validate emotions through empathy. I care so much about you, and I am so sorry that you're suffering. I don't know if anybody's seen the Brene Brown video. She explains so beautifully the difference between sympathy and empathy. But it's so critical that we are always genuine and able to put ourselves in the other person's shoes, or at least our best attempt. That really helps us with compassion and connection. And always bring an open mind in these conversations. I think sometimes we have a conversation, we think we know how it's going to go or what somebody's concerned about, and it's not so. We have to be open to what other people are going to tell us. Do a little reflection. I think I heard you say dot, dot, dot. Body language is really important. And it's hard to be thinking about all these things when you're having a conversation, but show that you care, hold eye contact, again, being fully present, avoid the judgment. Focus on really hearing that other person's perspective and never jump to conclusions. Hold space for that person. Use statements like, I feel, and try not to do this. When you do that, or anything that sounds blaming, that often will make people really defensive. Always pause before you respond. I cannot say that I have mastered that one, but it's one I'm working on. The pause lets us process what we're feeling. It's really important. And then another great strategy is to reframe things as a team. So if I'm the support person, instead of saying something like, what can I do? What can I do for you? Say, what can we do together to make this a better day? What is most important to you right now, and how can we focus on that together? It feels that connection, doing it together typically feels pretty good to both people. Another really important thing to discuss is honoring what is most important to people, because that is the ultimate act of love. Working as an ICU nurse for so many years, I saw so many people honor people's choices, and it's powerful. One way to honor choices and preferences is to ask yourself two questions. How do I want to be supported? And how can I be supportive? So when you're going through this experience, what does support look like? So there's some things that are maybe a little more straightforward, some of that logistical, instrumental support that you need. But what does emotional and social support look like for you? Do you need more time to yourself? Do you need more time with your person, right? The person that's supporting you? Do you need more time with other people in your life? Understanding what you want in terms of your care and your treatment is critical, and communicating that to other people does take practice. So, as a caregiver, you are there to be an advocate and ensure that the person you're supporting has full agency. So I'm going to kind of go back to these communication strategies and reframe them in terms of how we might be having a healthcare conversation about preferences and planning for the future. So the first thing that I'm going to recommend is to set an agenda, which that might sound a little bit silly, but it's very helpful because when you're talking about things that are very emotional, it's really easy to get off track and kind of forget what you came there to do in the first place. Work toward understanding and valuing the other person's perspective. And you may not agree with someone's choices, but respecting it and doing your best to understand where they're coming from is absolutely critical. The other thing is, and I don't know if other people struggle with this, maybe this is a me thing, but when I'm talking to people, I often have like this inner dialogue in my head, and I'm not fully hearing the person as they're talking to me because I'm kind of talking to myself. So having that mindful presence to try and be aware of that when you're doing that, because it's so important to be able to hear that other person and what they're saying. And, what do you need to do to be fully present in the moment? Well, you need to practice being present in the moment. This is a series of practicing and working at this. This is not going to be easy for anyone. Always, going back to validation, validating the person who is sharing. I appreciate you sharing this. Must be hard to have this conversation with me. Must be difficult to tell me about this. I'm so glad that you did. Use silence, hold space for each of you to process your emotions and the information that's being shared. We all need time to process. I think we really often get only about 20 to 30% out of a communication with another person. If we use that silence and we process a little bit, we're going to hear more. We're going to give ourselves that time. Restate things, make sure you heard things correctly by asking those clarifying questions. Do express your feelings, acknowledge feelings. When you say it out loud, that can help you sit with that emotion, and sometimes it helps you be more aware of emotions that are driving your actions, so you can reframe that to values driving your behavior and actions, back to that act. Write things down, particularly if about goals of treatment, choices, and preferences. This allows you to come back to them, be the source of truth, so you both know what you discussed. And another really important part of this is that this is not a one and done. This is often a series of conversations together, sharing what you want, what you're thinking about you want for your future. Attend as many appointments as you can as a team if that's comfortable for you. And talk ahead. How do you want to navigate these appointments? Do you want your person who's supporting you to just be taking notes? How are we ensuring that all of the questions are answered? Who's responsible for that? Are there any topics that you don't want to talk to your healthcare team about today? Are you ready to discuss questions related to prognosis, or if treatment stops working, like what the next steps would be? Maybe you're not ready for that today, and that's okay. But having that conversation ahead of time is important so somebody doesn't get caught off guard. Caregivers will often not ask a lot of questions because they feel like they don't have permission if they're not having this conversation with the person ahead of time. So decide together what you want to talk about with the healthcare team, and it will often be a much more team-oriented experience. All right, so now let's talk about some strategies for maintaining a strong relationship. So this is really putting a lot of what we talked about into practice. Express clearly what you need, provide emotional support, and ask for emotional support when you need it. It's okay to ask for that. Sometimes people don't realize that that's what you need. So just be very clear and tell someone. Make time for special activities together. And that can be simple. Maybe you don't have a lot of time. Like, it's crazy. There's so many things going on. But 10 minutes to have an ice cream or a coffee or a soda can be really beautiful. And it matters, that time that you spend with another person, where you can both sort of be in that moment together, have just a little bit of joy. Life really is just about those simple, joyful, loving moments. And those moments can really energize us when times are hard, thinking back to that experience. I recently went on a trip with a dear friend of mine, island trip, right? It was great. And um, during that trip, we were out in the oceans together, floating around. I got some good news when I was on that trip. I remember hugging her. I think back on that fleeting memory all the time. It really is hopeful and sustaining. So think about some of those moments in your life and how you can come back to those when things are difficult. Figure out what support you might need outside of your relationship, because we can't provide everything for each other. Maybe you need to take some time with your girlfriends, guy friends, that kind of thing. Set and respect boundaries. Boundaries are difficult, but they're so important. We need to be able to recognize our cues for each other when we need space and time away. And we have to honor those boundaries because people will come back when they're ready. And then it's a much more positive experience for both of you. And then finally, one of the healthiest things you can do is to seek professional support if you're struggling. It can be so helpful to do it individually, but also together as a team. So, how might you know when perhaps professional support might be a good choice? You're arguing nonstop. You're feeling emotional distance from each other or even a sense of resentment. One person is starting to withdraw a bit and you're not feeling like a high functioning team. You need some additional tools to really recharge and reset. So those are some good signals. And maybe you're not in that situation. It's never wrong to get some help and support to practice a lot of these things that I just discussed. It's a very healthy thing that you can do in a relationship because these are challenging skills, even though they seem very straightforward and simple. I also want to just take a moment to talk a little bit about men versus women caregivers. So, first, we know that there are a lot of female caregivers, what feels like a lot more than male caregivers. But I want to let you all know that men are actually about 40% of the 53 million caregivers in the United States. And men are starting to talk about their experiences as caregivers, which is fantastic. But our challenge is that men are very underrepresented in caregiving studies. So we have a lot more to learn about, for those who identify as men, what this experience is like for them. Now, I'm going to be a little stereotypical for just a minute, but men caregivers in general are a lot less likely to talk about how they're feeling. And this actually can put them at greater risk for adverse psychological and physical health outcomes. When we hold things in, that is bad for our bodies. Men tend to be more solution oriented versus women like to process things, process emotions. And so if you are, a woman who is being supported by a man, that can be difficult if you just want someone to process an emotion with you. And that person is like, well, here's the solution. Let's do this. So that can be really difficult. But recognizing that sometimes we think about things different ways can be the first step to really opening that conversation and helping reframe and navigate that situation and letting that person know what you need or what you'd like. Men caregivers are also interested in fellow men caregiver support, but that is hard to find. So, in my own experience running support groups, we have had a few male caregivers, but they are few and far between. So, I think it's just important to recognize that we need more forum and space for men to be able to do more processing, and maybe that would be helpful. The other thing I want to say about being a caregiver is that, most caregivers don't feel prepared for it. Now, I am a nurse and I know how to take care of people, but being a caregiver for my family member is still very hard because I'm connected to them in an emotional way. So it's important to recognize that caregivers need support and they need preparation to feel more effective in the work that they're doing. Many people do feel like they're not good at it. So finding ways, classes, opportunities to learn more about it, and then have a forum to talk to other caregivers is essential. I think there's also a societal pressure for caregivers to be very self-sacrificing, which can lead to a lot of burnout. Caregivers feel like, I have to do it, I have to do it. This is really, really important. I'm going to have to do it. And they keep going and they keep going, and they don't stop to take care of themselves. So, one of the most important aspects of caregiving is learning how to incorporate self-care into caregiving work. And that's equally important for the person who's diagnosed. You need to prioritize self-care as well. So, self-care and care for the caregiver are both very necessary things to stay afloat. Finding a way to manage the stress of coping with a serious illness is critical, and you each have to find what helps you, but then working as a team, you can help each other prioritize your self-care, right? Like it's easy to kind of be the other person to say, "Hey, have you done this for yourself today?" Like having that kind of reciprocal self-care reminder can be very helpful. I want to share tonight some lessons learned, very important lessons learned from patients and caregivers that I've worked with. You can't fill someone's cup from an empty vessel. You need to maintain your identity, continue to do the things that make you who you are as much as you possibly can. Not everyone's going to support you in the way that you need, but don't turn away from them. There can still be a relationship. Sometimes it's nice to talk to someone about something other than treatment or being a caregiver. So that's important too. And then always find someone who truly understands you, where you can have those in-depth conversations about how you're feeling, and to be able to not feel judged and to be as open as you can about what you're feeling. And of course, your life is going to change in ways sometimes that you didn't think it would, but don't despair. Find creative ways to adapt and keep doing what is important to you. So it may not look the same, but there are still ways to stay connected. And I'll give you an example of that. So I was working with a survivor who couldn't work any longer, and work was a very important part of that person's identity. But this person was able to do some volunteer work and work with children again, and that was very fulfilling to her heart. So that's what I mean about creativity. Maybe there's something that you can't do the way that you used to, but there are other ways to do it and stay connected. I do want to talk a little bit about managing worries. This is another critical part of your work. So this chart right here is from my colleague Allison Applebaum's beautiful book, Stand By Me. It is a book for caregivers. I do have a link to that in resources at the end if you're interested. But this is a really helpful way to work through worries that we may be having. So I'm just going to give you some examples to kind of show you how you might apply this in your life. So maybe your worry is, what if we can't afford treatment? So this potentially, especially in US healthcare, is a realistic worry, but you can't control it. So now we're going down the middle of the chart here. So the answer is no. And so your goal is going to be to manage your stress surrounding this. This might be a time for more self-care, maybe some distraction. Maybe your concern is, what if I can't provide enough support as a caregiver? So this is potentially an unhelpful worry looking at the left-hand side of the chart. So what you need to do in this situation is reframe your thinking. You're doing exactly what you're supposed to be doing, so you lean into that. You work on your self-esteem as a caregiver. Maybe you take a class that helps you feel more confident. Maybe your worry is, what if the side effects are so bad we can't continue treatment? So this might be less clear if this is realistic. Looking more at the right side of the chart. Yes, this could happen, but you need more information to know more about it. So you can become empowered by asking the healthcare team questions. So a great quote is that worry does not empty tomorrow of its sorrow, it empties today of its strength. So I think that's a really powerful quote to kind of keep in mind when, I think everybody has worries, right? And to be able to triage these so that then you can refocus some of that energy from worrying and use that to maybe do some more self-care, take time for yourself and do some more healing. The other thing I want to just touch briefly on is a term called positive engagement that was coined by a patient I was working with. Positive engagement is finding a way to let go and be in the moment, to allow yourself the chance to take a break from uncertainty. And it's hard to do, but it's absolutely essential to recharge, I should say, your battery. Now, you might only be able to do this for maybe 5 minutes in the course of a day, but it can make a really big difference in your life. So think to yourself, what helps you relax? Maybe it's listening to music. Maybe you like to listen to audiobooks. Maybe you like to read and get lost in a book. You can take a hot shower mindfully. Maybe you just need to disengage from the problem. Take a walk. Maybe just even move into a different room to get a different lay of the land. Sometimes that can reframe our brain. Find some laughter. You know, we all have that friend that makes us laugh. Humor is such a healing medicine. Find some peace. Maybe that's through nature. Maybe that's being with those you love. Figure out what that is for you. And keep asking yourself, what energizes you? What keeps you going? Because self-care is not selfish. And it's absolutely necessary to be the people that we want to be. Now, tonight, we have talked a lot about the difficult emotions and what's challenging, but there are a lot of positive things that occur too as you're navigating this experience. You know, certainly you might find a new sense of meaning and connection, maybe a deeper relationship with people in your life that are supporting you. You might experience a new sense of closeness with the person you're supporting if you're in the role of a caregiver. You might appreciate things that you didn't really think too much about in the past. And staying connected to these positive aspects can really fuel you and be your compass, your North Star, if you will, when you're struggling. Reaching out for support is the bravest thing that you can do. Let people help you. Let them bring you a meal. Let them take you to coffee. Let them mow your lawn, maybe snow blow right now, right? The snow blowing of the driveway. Let people do that for you. Do what you can and what feels right in terms of what you want to keep and maintain relationships in your life. Reach out to people if you can, if that feels right for you. Talk to someone who understands. Again, that's where this amazing resource, ABCD, comes in. It's so important to have that peer-based support. And it really is important to feel like you're with people where you can truly be yourself, share everything, and not feel judged. Seek out a therapist for yourself as an individual or as a patient and caregiver team, right? Consider a support group as well that you can really layer your support. And there's different things that we can get from different modalities of support. So I do want to emphasize that together we can do this. You are not going to do this alone. Finding community and social support is so essential for navigating the cancer experience. And it's essential that you take some time to think about ways that you can care for yourself. I do have some resources, and I'm sure that we'll be sharing the PowerPoint. But I would love to now turn to all of you to hear about strategies that have worked for you, challenges that you're having, and we can process that as a learning community.
So it looks like if you have any questions, you can raise your hand or put it in the chat and we'll read them out. It looks like we've got one in there right now. Just what happens when someone says the wrong thing or something that's, you know, somebody, this is really dumb stuff, like somebody who, when you're faced with cancer, says, oh, I had a friend who had cancer and she died.
Oh, that is a tough one. I'd love to hear how other people have handled it, but I think that sometimes I think it's also okay sometimes to, kind of disengage from people that are not therapeutically helpful to us, right? I mean, if that's kind of the response that you're getting frequently, maybe at the moment, that's just not the right person to have in your life. I think another approach certainly could be to, be open and honest with that person if you have a strong relationship with them. It's a little different. Maybe it's a coworker that you don't know very well, but if it's somebody that you do know really well, maybe that is an invitation to have some open, empathic communication to help them understand your perspective and what that feels like for you. That's not good. That's not helpful. So think it really depends on who that person is. But I'd love to hear, I'm sure this has happened to other people, like how people have handled that or what you think what was the right thing for you.
Yeah, it looks like Cheryl had a response that when someone said that to me, I replied, well, I am hoping that is not my outcome. So kind of puts the onus back on the person. Yeah.
Yeah. Yeah, great strategy.
Okay, there's another question in here. Allison would like to know any suggestions for when you want to help support someone, but they don't know what they need. Some people have a hard time asking for help or don't know what would be useful, and asking them what do you need over and over is not useful.
Yeah, I think in these circumstances, sometimes you just do stuff. Like you just go ahead and bring over lunch. And if they throw it away, they throw it away, right? Or um make plans, and if they decide not to come, maybe you orchestrate a night at the movies or something like that. And if they choose not to come, that's okay. But you're showing that person, if they don't know what they need, that you're still there and you're making an effort toward providing support, because like sometimes you really don't know what you need, and it's helpful when other people just take initiative versus asking you and asking you and asking you. That would be my approach, but I would love to hear other people's thoughts about that as well.
I would just say, for me personally, and what I've heard from some others, like doing something is always better than doing nothing. Like it just lets the person know. And like you said, whatever they do with the gesture, that's what they do with it. Or maybe it'll trigger them to say, "Hey, you bought me some fuzzy socks, but I next time, bring me lunch, like it, or invite me to coffee." Like it might trigger them to initiate that conversation about what they need.
That's great, Keisha.
Yeah, it looks like there's another response. Oh, sorry, Linda, go ahead.
Well, that's okay. I was just going to say what I've done is if I say, what would you like? What can I do? What would be helpful? Sorry. And they say nothing. It's like, say, well, next time I come, why don't I bring lunch? What would you like? Or if you don't want that, I just read a really good book. Would you like it? Want to borrow it? And I try and offer things so that if they don't know what they want, maybe it'll trigger something.
I love what Kathy shared, that a friend every day she sent a text, and it was just a funny story, or some kind of support that she loves you. Like that's really, instead of how are you doing, you don't want to hear that over and over again. So I thought that's really beautiful, Kathy.
Yeah, I had a question. How do you feel about if you are caregiving for someone and you have a visceral response, or almost it makes you angry with the decision that they make? You're not angry at the person, but you're angry at their decision, but it might come across like you're angry with them, and how to avoid that or not put yourself and the other person in that situation.
Oh, Carrie, you're asking a really hard question. No, I think that's a great question. I think that yeah, it's hard when we have a difference in opinion, right? Because we love that person and we both, I think, I think a palliative physician had a great strategy. It's like we both have the same goal, right? We both want what is best for you, right? Or, but we also at the same time, we have to really hear each other's whys. And I think that takes an open mind and, having that open communication. I think it takes practice. My face is an open book. I have a hard time with trying to temper that. So I think these are, these communication skills, everybody's trying to master these at all times, right? It's a lifelong work. But then maybe as a caregiver, why am I disagreeing or why is that such a visceral response for me? Like what is underneath that? And maybe it's really an emotion driving that, outward, reaction versus, really my value, which is I love you, I want to support you, I want to do everything possible to make you feel supported, right? Like maybe it's really that emotion. So I think that's where that ACT can be really helpful. I feel like ACT was a life changer for me to think about this idea. I mean, I often am yelling at myself, like, why are you so mad about that? Or what? It's okay. Like, we're human and it's okay to not agree and it's okay to feel sad and upset. And when you give yourself permission to do that and not judge yourself or try not to judge other people when they feel those emotions, it can be really empowering. It's a very different frame of mind and state of being. So I don't know I really answered your question, Carrie, but I think it takes work when we disagree.
No, I think that's great. Yeah, I was just thinking too, because we do get some of those questions from caregivers that are just looking at can I help my loved one, but also it is a loved one. So they don't have a space outside of maybe that loved one that they are caregiving for to release those feelings, right? To just say, I'm angry, but it's not because I'm angry at them. I'm fearful of the future. I'm fearful that this will happen. And I think fear drives a lot of it and maybe guilt. And so, yeah, I'd love to hear if anyone, I mean, I think you answered it perfectly. And I think practice and ACT is probably a really great tool. Anything else that people might have that to kind of let that go, to let those feelings go. And it doesn't always have to be anger, just, letting some of those things go.
Yeah.
And I do see some additional, some good comments in the chat. I think Claire was asking for us to put in a quote about worrying.
Oh, sure. Oh, yeah, I can cite the person. You want me to put that in the chat?
Yeah, or we can
Pat?
put it in. Yeah, if you want it. Was it a long
I
quote
will.
or was it?
It's pretty short. I'll put it in. You may
Okay.
not have it.
Okay.
It's in my notes. I will put it in.
Okay.
Absolutely.
Okay.
I love that. I love that that spoke to someone and that was helpful. Um,
And I think I see just one more comment, was about people, sorry, trying to scroll through to the last one. How they might say that you look fine and maybe you're not getting sorry, scroll down to it. I have a very hard time asking for help for multiple, oh no. Well, I'll read this one from Julie. I have a very hard time asking for help for multiple reasons, but yes, I agree. Just do, just bring lunch. Yes, may trigger and ask later, but definitely do something. And there was one more. Oh, I see the quote now. Carrie, can you see that last?
I can, yeah.
My
It
computer's
says I
acting.
really struggle with people telling me that I look so good and don't think that I need emotional support. When I was recovering in my jammies, it seemed easier for people to want to reach out, but I still needed their support. I think this is really common in this space and in other spaces also. It's like, well, you don't look sick. And so I think being someone's advocate is super helpful, but also, how do we, I think that's the question, Dr. McAndrew, is like, how do we get people to still care and want to help us, even if we don't look how they feel we should look when we're ill or not doing well?
Well, I think the world needs a little round of emotional intelligence, that's for sure. Yeah, I think a lot of people that don't, especially maybe in other non-healthcare related professions, business, it's like people don't really, unless they've experienced it, like it's hard for them to really think about, yeah, I'm sure that person's still needing some support. This is an experience that, is forever changing, that will impact me. I think part of that is just having to sort of educate people, unfortunately, to kind of, I think sometimes a story can be helpful for people, and I think we can tell that story in a kind way, but a pointed way so that they get it. Um, but yeah, I think unfortunately there are just a lot of people that just have no context for the experience, and then that feels isolating, right? Like that feels yucky. So I think it's how comfortable you feel, being able to, again, how well do you know that person, and do you even want that person's support? You know what I mean? Like I think you have to think about that too. But certainly if it's a person that you do want support from and you want that person to be checking in, I think you feel you need to work on your own self-empowerment to say, this is what I need from you. Like you may think this and that because this is how I appear right now, but right now I'm feeling X, Y, and Z, and I'm really hurting and need someone to check in on me. I just think you just have to work toward that very open and honest communication, even when it's uncomfortable.
Yeah, I really like that. And I think that's where places like ABCD comes in. I think reaching out to peers and having peer support is so important because we have walked those in your shoes, and we understand and can validate where you're at, even beyond as you're recovering and into the future. So surrounding yourself with peer support, if you're a caregiver, if you're someone that's gone through an illness, breast cancer, anything like that, I think seeking out peer mentorship or peer support is so important. So it looks like we have one other comment. And then I think we'll wrap it up. It is 7:30, and we want to thank again Dr. McAndrew for joining us. This was so great. Thank you so much. So Lori just said also telling you or comparing, and sounds like a comparison comment, like, well, you didn't have chemotherapy, you only had radiation, so you don't understand those of us who have lost our hair. That's hurtful, trying to justify how I am doing. So yeah, the comparison game sometimes is very hurtful, and yeah. Any comments on that just to wrap up, Dr. McAndrew?
Yeah, it just sucks. I think sometimes people their comments just suck. I think there's no better way to say it. But I do think that sometimes we need to help people understand when they've said something that makes us feel invalidated or hurt. Um, that feels really yucky. And again, I think I typically will do a measure of like, how much do I like this person? How much do I like having this person in my life? Like, I kind of do that first before I decide how much vulnerability I'm going to have with that person. Because it takes a lot of vulnerability to say, that really hurt me, and I need you to think about things before you say them. Like, that's a hard thing to say, but good people that you love and want in your life will and should respond to that. That would guess would be my take on that.
Thank you so much. Again, Thank you everyone for joining us tonight. We're so excited to offer these LEAP series every other month. So be looking for the next one. We'll be sending the recording out and some other resources that Dr. McAndrew has been nice enough to provide to us. And then also some resources about ABCD and a survey just to let us know your thoughts. So have a wonderful evening, everybody. Thank you so much for joining us.
Take good care. Bye.